Hi everyone, this is part 2 of how to resolve chronic illness faster. So in my experience, in addition to the things that I mentioned in part 1, where essentially making sure that we're addressing all of the underlying root cause factors that might be contributing to the symptoms or issues that a patient is dealing with, another thing that I have found to be very useful in a number of cases that I've worked with is working with intravenous therapies. IV therapies are certainly talked about quite a bit. A lot of us who do, integrative treatments, and especially those of us who are working with complex chronic illness cases, will oftentimes work with intravenous therapies as an adjunct to our treatment protocols. And what I find is sort of interesting, or kind of my spin on it, so to speak, or my take on it, is that there are lots of great IV therapies out there, and you can find case reports and anecdotes of folks who have had amazing results from a lot of different IV therapies, but they're not a magic bullet for everyone. So to say, oh, you've got, say, chronic Bartonellosis and mold illness and elevated levels of lead in your tissues, and that's all causing mitochondrial dysfunction. Well, so therefore you need ozone therapy. It's like, well, maybe, but maybe not. Not everyone with those underlying issues necessarily benefits from ozone therapy. Ozone is generally very well tolerated when administered intravenously, but people can sometimes flare from it. Not often, but sometimes. And not everybody feels fantastic when they work with it. And so there's really certain underlying factors or clinical features, I should say, of a patient's case that would kind of point us in the direction of, are you going to benefit more from, be more likely to benefit from this or that therapy? So some of the therapies that I found to be the intravenous therapies that I found to be the most useful would be ozone therapy in well-selected cases. Sometimes using high-dose nutrient infusions can be helpful. A lot of folks listening may have heard of something called the Myers cocktail, which is a nutrient infusion, and it's a pretty robust dose of nutrients like different vitamins and minerals. We do work with those Myers cocktails, but we also work with what we call a high-dose nutrient infusion, where we're using even higher dosages of a number of those vitamins and minerals. We also add in extra amino acids like taurine and carnitine, for example. We also will oftentimes add in some NADH as a sort of particularly active form or usable form of vitamin B3, and there's a couple of other bells and whistles in there as well. So sometimes using a really mega dose of nutrients like that can be really helpful. We also do something called intravenous photobiomodulation, also known as IV laser therapy, so that can be helpful, and there's different frequencies of laser that we can work with, which some of them are more anti-inflammatory, other ones are more to stimulate the mitochondria to make more ATP, other ones have more of an antimicrobial / anti-infectious property to them. And then there's other IVs too, like chelation therapy and IV phospholipids and alpha lipoic acid and different things like that, glutathione, etc. So the IV agents can help patients to get better faster, because basically we can get a higher sort of treatment dosage into their bloodstream essentially much faster. We can build up to higher concentrations of what can be achieved through oral dosing in a shorter period of time. And then in some cases, like say ozone therapy or IV photobiomodulation, you just can't really replicate that with something orally. It's just not really possible. So we get sort of these, what we call a supraphysiological dose all at once of a given agent in question. So like more than what we could achieve through sort of normal physiological mechanisms or methods. So that's why IV therapy can be an accelerator pedal to help people get better faster, but we do need to be really mindful about what we're recommending. So is the patient going to tolerate it? Is this likely to actually be helpful? Because again, it's not a one-size-fits-all for patients, and that's something that I talk about a lot, because it really does need to be a tailored approach. It can get so nuanced, especially with these complex chronic illness cases. So if anybody has any questions about any of the specific therapies that I mentioned, please feel free to comment in the comment section below. I'm happy to talk about those things in more detail if anybody's interested. And otherwise, I hope this video was helpful, and stay tuned for part 3.